Hello and welcome to this episode of Where Health Happens. I'm Mike Morland. For many people, physical therapy comes into their life when walking, working, playing a sport, or simply moving without pain suddenly becomes more difficult. And that's where physical therapy can make a real difference. It's not just about recovering from an injury. It's about rebuilding strength and confidence, regaining independence, and getting back to the things that matter most. Today, we're talking with Wayne State alumnus Roberto Merucci, a physical therapist, clinical director, and mentor whose career has taken him from the classroom into leadership and patient care across Metro Detroit. We'll be talking about what drew him to physical therapy, what he's learned along the way, and what the profession really looks like from the other side of the treatment table. All right, so let's take a moment. Tell us a little bit about yourself, what drew you to this industry and Wayne State as a student.
Yeah, so great question. My journey to PT, I don't want to say happened on accident, but was not my original plan. So in my college undergraduate years, I was attending Oakland University and I had realized I definitely want to do something in the medical field. I was through my first year there, really enjoying just the medical field, the anatomy, things like that. And as I was preparing to strengthen my application for med school programs, I began shadowing in clinics, doing observation hours, just trying to get patient contact hours. And with that, I ended up in a physical therapy clinic. And it was really my first exposure to the inside of a clinic of what physical therapy really is. And the longer time I spent there, I realized this is much more of my interest, my personalities, my hobbies. So I'd always been, I was a weightlifter. And I always enjoyed the medical field, and this seemed to be the perfect blend of the two to where I can combine, the rehab sports principles with the medical field principles. So I ended up making the switch a little later than I probably should have in my third year at Oakland when I was a junior. And then I was able to get my application ready, and I just began applying to PT schools all over the place. PT is a pretty hard application process in the sense of there's traditionally a lot of applicants and not a ton of spots. For example, like Wayne State only had 36 spots at the time.
Mm-hmm.
And so I had heard great things about the physical therapy program at Wayne State. I had already done my 4 years at Oakland. And so when I got accepted, I decided I want to make a switch. I'm ready for something different. And that's how I wound up at Wayne State.
So as you were making that decision to come to Wayne State, did the thought ever cross your mind that maybe you needed to get into the field first and get some experience? Or were you really passionate about, I need to go back to school, get this professional degree to really get where I want to go?
The way that I was sort of flowing through my schoolwork, I thought the best thing to do would be just getting right after it. I decided that, I could wait a year or two or even a couple and do some other career path that my bachelor's degree would have allowed me to, but I decided,
Uh-huh.
I'm fresh in school. I'm retaining things very well. I'm up to date on all of
Mm-hmm.
my, from anatomy to all my other courses. And I decided the longer I wait, probably the harder it would be for me to transition back into a very rigorous
Right.
program. So I decided, let's just go for it.
Okay. And so fast forward now, you're at Wayne State. What do you remember most about your experience with the program?
I think when you're in the program, it's easy to think how hard it is, how grueling it is. But I really miss just the everyday interactions with my classmates, with my professors. You're in the same class of 36
Mm-hmm.
for essentially 3 years. So you get to know these people very well. You're spending 40, 50 hours a week with them sometimes. And just going through the process together, we had a lot of fun. I met a lot of people. Actually, my wife was one of my classmates. We met 11 years ago, 12 years ago, and now we're happily married with 3 children. So I still keep in contact with a lot of my buddies from that class. And it was just a fun time overall. The university gave us good opportunities to meet people, but also moving forward, prepared us for our field.
And so after graduation, where did your path take you next? What was your first opportunity working in the field?
So when you're in the program, you have to complete obviously all your field work, all of your clinical rotations. And I was living in Oakland County at the time, and my wife was living in Wayne County. And when we're getting ready to graduate, you sort of start thinking, okay, where am I going to be taking a job? Where should I look for a
Mm-hmm.
job? And so she was my girlfriend at the time, recommended this company to me called Team Rehab. And I've heard the name before. I never did a rotation at any of their clinics. And she had fantastic experience there. And so she recommends me to the clinic that she also did a rotation at. She ended up taking a job at a different clinic, and she recommended me the clinic that she did a rotation at a year ago. And so, being from Oakland County, not familiar with the Downriver area, she goes, "Hey, there's a place called Team Rehab Southgate." And I'm like, "Man, where is Southgate? I've never even heard of that." So I decided to take an interview. It's one of a pretty good amount of interviews I did. And I remember, okay, this is definitely the best interview I did in terms of, what they had to offer and the setting and all the feelings and vibes I was getting from the director there. So I ended up taking this job. And I remember my very first day driving, down 75, 25 minutes to
Hmm.
Southgate, thinking like, man, what did I do? Like I had some clinic offers near my house at the time. What is going on here? And I just remember walking out after the first day, like, wow, did I make the right choice? I had a ton of fun, had the autonomy to treat my patients, was given everything I needed to succeed. And then I've been with the company ever since.
And so you talk about the autonomy, treating your own patients. What was it like going from being a student and getting that guidance in the clinic versus doing it on your own for the first time?
So you always hear the term brought up a lot of times in the medical field as well, called imposter syndrome, where you think, okay, I have this title, I have this degree, I've made it, right? And you're really just getting your feet wet. And one of the things I was really thankful to Wayne State about was I feel like I was so well prepared that I didn't have much of that. I didn't have that, oh my goodness, what if there's something I don't know? Or what
Hmm.
if I get the one-off patient of a rare condition I've never heard before? It was really like, man, I felt really prepared, really confident walking in there, in part, mostly thanks to Wayne State and what we were taught. So the transition was still, though, one of a little bit of hesitancy. You're right. You're a student, you have a clinical advisor above you that anything goes wrong or anything crazy comes up, I can run and ask a question to.
Right.
And so when you get your license and you start practicing, you feel like, oh man, I'm supposed to know everything.
Hmm.
And the clinic was set up fantastically in the sense of there was 5 other therapists there. It was a fairly large clinic. And then coincidentally, most of them were Wayne State grads. And so everyone was so friendly, and anytime I had a question or, hey, you know what? I've tried this with the patient. What do you think? We were able to brainstorm things. So it was
Hmm.
just a fantastic, transition into a professional career.
Yeah, and you mentioned the imposter syndrome, and I think that's really common, especially coming right out of college. People often feel that even though they've received the training and they get into the field, they think, am I supposed to be here? Do I know everything I need to know? And one of the things I'm sure you've probably learned this too throughout your career is often it's not about what you know, it's about the people you surround yourself with to help you have all the knowledge that you do need. Because I think it's unrealistic for anybody to assume to know everything, especially in the medical field. There's so many complexities. People have different experiences. People are different points in their career. And I think it's always important for people to remain a little grounded. Remember, you don't need to know everything. You just need to be able to access the resources to know everything you need to know.
Yeah, 100%. That was the one thing where you're like, okay, yeah, it's okay to sometimes say, you know what, let me get back to you,
Hmm.
or I don't know, and then find a very credible source.
Right.
And I'm thankful that didn't happen a ton. Like I said, I really felt just very prepared, even on my clinicals with what Wayne State had taught me. So I was very thankful for that. And I still say that to a lot of
Hmm.
my prospective students or employees who want to go on to physical therapy school when they ask me about Wayne State versus other schools. And I say, you know what, I never attended another school in terms of physical therapy, but I can tell you I felt extremely prepared going to
Hmm.
Wayne State. So it's just something really cool.
Yeah. And so let's pivot a little bit now to getting a better understanding of the industry. And I think a lot of people associate, with good reason, physical therapy is about recovering from injuries or surgeries. But what are other aspects of the profession that people may not realize that are so important to the success of it?
So the cool thing about physical therapy is it is such a vast field. Now, I think when you hear PT, you think, okay, outpatient orthopedics,
Hmm.
surgeries, injuries, things you just mentioned. I think that a lot of people don't necessarily realize there's so many more branches and avenues than that.
Hmm.
There's pediatrics, there's geriatrics, there's hospital acute setting, inpatient rehab, home therapy, um, ICU trained therapists. And then you have all the way up to your high level sports and performance coach therapists.
Hmm.
And that's everything from insurance based to cash based. There's just it's such a big field that once you graduate or once you become a therapist that's licensed, you can really go whatever route you want. You can make your own path. You can join a big system, hospital system. There's just so much that you can do in the field that I think a lot of people don't necessarily even think about it.
And so when patients first come to you, how does a physical therapist determine what recovery might look like? Because I think often people think of it as a linear process where you just get in and every time you make progress and eventually you're close to normal or back to normal. And very rarely in life, I think anything is linear. So can you speak to that a little bit and what that experience is like for a physical therapist and also how they convey that to a patient that's recovering?
Absolutely. So that's actually a question we'll get quite often, and I've had to get really good at answering over the years because when you first graduate, you go, okay, I know all of these tissue healing times in my head, bone healing times.
Hmm.
I know roughly this protocol, this guideline of what should be happening. And then what I learned very quickly after getting out and starting to practice was life doesn't happen in a bubble. I always tell
Hmm.
my patients when they ask me that question, I could give you such a better answer if I knew you were going home to a padded room and doing nothing, right?
Right.
But, people have houses to maintain, jobs to keep doing, kids to take care of, whatever variable it is.
Right.
So we sort of get into the weeds of, okay, we want to make sure that we're healing properly. We're giving your injury the best possible environment to heal while avoiding the daily life irritations, setbacks, things like that. You've sprained an ankle or you've had a knee surgery and you're going up and down your stairs constantly to do laundry in the early, couple days right after the surgery. Probably not going to be great in terms of keeping it irritated, but I always tell people we also have lives to live. We got to
Hmm.
come up with strategies to cope and to
Right.
get through and compromise so that way your life doesn't become such poor quality that you can sort of maintain that normalcy.
And so, in cases where patients, and you were just talking about how often in your head you're thinking, okay, I know it takes this muscle group or this bone this long to heal. When patients aren't hitting those markers and recovery is taking longer, maybe they're making progress, but it's taking longer. What do you do as a physical therapist to keep them encouraged and optimistic that things will continue to get better?
I think one of the biggest things we can do, and sometimes it's hard to do in the medical field, is just be honest in the sense of telling a patient something maybe they don't want to hear. For example, I have a marathon runner right now, and he does not want to stop running.
Mm,
And part of the therapy is trying to get through to him and make him understand, you know what? It's a short term. We got to give it up just a little bit to allow a little bit more quality healing before we can get back into it. It's better to take 2 weeks off to allow more healing than to do
hmm.
slightly less running, but keep this injury going, keep this fire stoked that's
Hmm.
preventing you from getting back to full strength. So I think you just got to come out and be honest and tell your patients, which I think is something early in my career. I never wanted to tell a patient, yeah, stop golfing. Yeah, stop running.
Right.
And I realized that maybe long term, it's just something that was best for them.
Right. It's something you just mentioned. So myself, I've gone to physical therapy in the past, and I remember as a former athlete, one of the things that my physical therapist and doctor both had mentioned to me was, you can continue doing the activity that you want to do. However, it will increase your risk of re-injury and long-term complications, etc. And for me, hearing that both, because I think it's one thing coming from a doctor, obviously there's a level of credibility with that, but hearing it also come from a physical therapist who's been working with you, who sees these injuries, for me, and I hope it works this way for other patients too, it gave me the opportunity to reevaluate how important is this activity to me versus my long-term health. And for me, having that physical therapist be very honest with me to say, yeah, you can do this, but there's going to be trouble down the line most likely because this is a injury that isn't going to completely resolve. And so it helped me decide, you know what, maybe it's time to walk away from this and my long-term health is more important. So I know that was helpful for me hearing it from a physical therapist. How challenging is it for you on that side of it to have that conversation sometimes with patients to help them realize that, yeah, they can do something, but it may result in issues down the road?
It's definitely a tricky line to walk because, one of our beliefs, especially as therapists, is you don't go to a therapist to, hey, it hurts to lift my arm, for me to just tell you, okay, don't lift your arm.
Right.
Hurts when I run, okay, just never run again. So you're going to exhaust all options you can to
Hmm.
get that patient back to running. But there are some rare circumstances with, certain disease progression or diagnosis where, hey, maybe we need to be strategic with how we modify this.
Hmm.
And so I think that honesty, it goes a long way. And then I think sometimes too, like you just mentioned, personal rapport with the patient,
Hmm.
it goes a long way. So I had a patient who was a power lifter, and we sort of bonded over the fact that, in my early college days when I was working out and lifting heavier weights,
Hmm.
how much easier my body recovered.
Yeah.
And so as you fast forward, 10, 15 years, or in his case, 25 years, we started talking about like, is this the best thing long term for your body?
Yeah.
Could you continue to power lift and do large amounts of weight? Absolutely. But is your recovery going to take longer and longer? Are you going to have nagging injuries that stress on the bone and the joints just isn't worth it? It's, that's a decision the patient has to make. But
Right.
as a medical provider, it's your job to at least give them the information to make a good decision.
And so, you mentioned you've been working physical therapy for quite some time, but I know you've also transitioned to being an assistant clinical director. How has that shaped how you look at the industry, as well as how does it change the day-to-day of what you do?
So that's one of the reasons that I really loved when I came over to team rehab was I had the options to ascend in not just my therapeutic skills, but learning the business owner role, some of the daily operations. So when I first graduated, and I was eager to hit the ground running and I wanted to learn all this business stuff, I had a good mentor at the time who said, "Hey, you just got out here. Let's focus on making you the best clinician we can for the first
Hmm.
couple years,
Right.
and then we'll worry about the other stuff." So that's what we did. And I took a lot of continuing ed classes. I just learned as much as I could from my fellow clinicians in that clinic with me, and I just wanted to be the best therapist I could be. And then as time went on, opportunities arose for becoming the assistant clinical director and then the acting clinical director. And then I was asked to open my own clinic and become a clinic director. So
Hmm.
that has sort of morphed into um, maybe a couple more hours of my week.
Yeah.
Are a little bit more on the business end, making sure the clinic's operating well, making sure we're staffed appropriately, making sure we're seeing patients and things like that. But then I also, struggle to ever give up my treating patients, being with the
Hmm.
patient, working with them hands-on, coaching them through high-level activity, things like that.
And so now that you work a little bit more in that mentorship capacity with younger physical therapists, what do you encourage them or what type of advice do you provide to them early in their careers that maybe either you received or you wish you would have received?
So I think the big one was exactly the advice I was given. We'd hired a new therapist in January and she was ready to hit the ground running,
Hmm.
which you love to see as an employer. You're like, wow, this is fantastic. This person's motivated. And I wanted to make sure that she was just absorbing as much information as she could. You graduate and you think, okay, here I am, but there's still so much more to be learned.
Hmm.
And I think that's a good, piece of advice to give anyone, when it was given to me and then when I passed on to her is, hey, there's so
Hmm.
much more to learn here,
Right.
but also let's not rush anything. Let's make sure we're really understanding these new concepts or these
Hmm.
new scenarios or just experiences with patients that, because every patient has that diagnosis, but every patient's demeanor is different, every patient's learning style is different, so there's so much more that goes into it. So
Hmm.
I would say when you get out, when you first start, just be a sponge. Just learn
Hmm.
as much as you can. Pick the brains of the therapist around you. Whenever you have a complex case, bounce ideas off people, and just do your best to learn as much as you can.
And so to take that one step further, going back into the classroom, if you were speaking to a group of students who might be interested in physical therapy as a career path, what advice would you give them, or what would you tell them about the profession to sell it to them in the sense of why it is a fulfilling career?
So there's the one of the coolest things still to this day after 8 years of me doing this is seeing the patient walk in and then having that mental picture of them.
Hmm.
And then 6 weeks or 8 weeks later, when it's their last day, and seeing such a drastic change in performance. So
Hmm.
we talk about this all the time where patient will come in on a walker or a cane and leave with nothing. And they'll
Hmm.
reference that on that last day. And that's still such a cool feeling for me to see is the change that I was able to help this
Hmm.
person get to.
So we're almost out of time, but I had a couple last questions for you here. Um, what would you say is one of the biggest misconceptions about the industry and what you would like to change that perception of it?
That's a great question. PT often goes through a lot of struggles with how it's perceived publicly or in the eyes of insurance companies.
Hmm.
And I believe PT done correctly is such a valuable thing. I
Hmm.
wish PT could be done more with the coverage of insurance to patients on the pre-injury or prehab side, if you will. So we know that, there's data out there that'll say people who are more active are X, Y, and Z, right?
Hmm.
Well, if we can get to, for example, the elderly and do fall screens and injury prevention to prevent, fractures and things that could lead to hospitalization or serious complications down the line, as well as, maybe go into a high school and do a screening on the high school girls soccer team. And the reason I use that reference is we know at that time, with everything going on in the body, they're more likely to have soft tissue injury. So
Hmm.
how do we get ahead of that? I would love if it was insurance took the, hey, let's be a little bit more proactive and
Right.
prevent these injuries instead of reactive and just wait for the ACL tear to happen or the femur fracture to happen and then do surgery and then do therapy.
All right. And so the last question I have for you, and I think your previous answer touched on this a little bit, but what excites you about the future of the profession? Now, you just talked a little bit about what you'd like to see, but what is currently happening now that excites you about the profession?
I think that there's a big change in one going more towards that prehab type scenario, or at least people wanting to take it upon themselves to do it. So there's that, the piece we already talked about. And then there's all sorts of new technologies coming out in
Hmm.
terms of, before maybe we just got our goniometer, which is the tool that therapists use to measure joint range of motion.
Hmm.
But if we can get a little bit more techie with it and something simple that we can just give to therapists, say, okay, instead of doing a manual muscle test grading, here's a little sensor you can use. Boom, 36 pounds of force or 50 pounds of force, something hard and objective, that makes everything a lot more clear. So there's a nice trend in that direction right now. We're seeing a lot of tech companies start up and go that route. So it's
Hmm.
exciting to see what therapy will be like in the future.
So we're out of time. I want to thank you again for joining me. It was great being able to talk to you. And please continue doing the work that you're doing and being an advocate for not just Wayne State, but the industry. As you mentioned, physical therapy is such an important aspect of the overall holistic piece of health that I think people value when they need it, but may not always think about it a lot until they do. So with that, I just want to say thank you again for your time and for the work that you do.
Hey, it was my pleasure. Thank you for having me. I had a blast.
And with that, we'll leave things there. I want to thank Roberto and everyone who listened to today's episode. If you're new to the podcast, be sure to check out some of our previous episodes and hear more conversations with the people shaping and impacting healthcare and how that impacts all of us. So until next time, I'm Mike Morland, and this is Where Health Happens.